NUBEQA, darolutamide, is a prescription medicine used to treat adults with prostate cancer that has spread to other parts of the body and responds to a medical or surgical treatment that lowers testosterone in combination with docetaxel. It is not known if NUBEQA is safe and effective in females or children. Watch the full video for more important safety information.
I'm Tom Green. I'm a retired urologist. About 20 years ago, I was diagnosed with prostate cancer. Here's my story. I still feel that I have something to give back to people who have taken care of me and to my community, and I can do this in a way to help people get through the fears of having prostate cancer. I found over the years that the unknown can be more frightening than the known, so I encourage people to keep track of the questions they want to ask their healthcare team and lean on them for information. I'm very thankful that I had previous knowledge about prostate cancer before my diagnosis. This allowed me to talk to my family in a straightforward manner and reduce their worry. However, I was still surprised when I found out the cancer had spread to my bones. After 19 years of multiple treatments for prostate cancer, an elevated PSA meant further testing was needed. I didn't feel any different, but it was clear from the testing that my cancer had progressed. Because of my medical background, the discussion with my oncologist was quite different than it was when I talked to most of my patients. I knew what questions to ask and had a strong understanding of my condition. My oncologist and I went over my treatment options, including NUBEQA. Together, we reviewed the Arison's clinical trial, which studied NUBEQA plus docetaxel and hormone therapy. As a urologist, I understood the clinical trial data. Based on the efficacy, overall survival, safety, and tolerability of the NUBEQA combination, we felt it was an option worth considering. We talked about the potential serious side effects such as heart disease and seizures. And we talked about the other side effects such as loss of appetite, weight gain, hypertension, constipation, change in liver function tests, anemia, and change in blood glucose. Based on my medical and personal experience, my doctor and I decided that the NUBEQA combination was an appropriate option for me. Though most participants in the clinical trial were able to complete the 6 cycles of docetaxel, I had a different experience. While I was on chemotherapy, I became very ill with an inflammation in my lungs. We had to stop the chemotherapy, but we were able to continue the hormone therapy and the NUBEQA. When you have side effects from these medications, the most important thing is to report them to your healthcare provider. And then they can look at your treatment and potentially change, stop, or alter the treatment. I've seen firsthand with my own patients how overwhelming treatment conversations can be. When I think about people advocating for themselves, I think of 2 routes that they need to think about. One is to get as much information as they can about the disease so they can learn about what their options are. The other is to find a care team that they trust. I can't tell you how important it was to have my wife by my side, to come to the appointments, to ask questions that I didn't even think of. I had my kids and my friends to help me along. I feel that as a good patient, I have to make sure that I can make my caregivers feel good and appreciated on my better days. It's so important to always remember to be kind to whomever is helping me manage this journey and show them how much I acknowledge and appreciate all that they've done for me. Playing music is one way I show people in my life how I'm feeling. It allows me to express how much I care about them. I've always really enjoyed music. My grandfather was a songwriter, and my father taught me a lot about classical music, and so it has always been a part of my life. The photo was taken about 30 years ago, soon after I had moved to town, and I just remember being at our friend's house, playing piano for them, and we were just enjoying life. At times I'm able to just shut my eyes, my fingers go across the keys, And all I can think about is the beauty of music itself and the many things that have been written that are so touching. I see that photo and I see the joy I had at that point, which I still have. And the fact that we're going to be able to do that again just shows that I still have the joy in me that I had many years ago. When I was a treating physician, NUBEQA wasn't approved yet to prescribe to my patients. But when my cancer eventually progressed, I'm grateful it was available when I needed to consider options for myself.
Important safety information. Before taking NUBEQA, tell your healthcare provider about all your medical conditions, including if you have heart problems, high blood pressure, diabetes, or high amounts of fat or cholesterol in your blood, dyslipidemia, have a history of seizures, brain injury, stroke, or brain tumors, have kidney or liver problems, are pregnant or plan to become pregnant. NUBEQA can cause harm to your unborn baby and loss of pregnancy, miscarriage, have a partner who may become pregnant. Males who have female partners who may become pregnant should use effective birth control, contraception during treatment and for 1 week after the last dose of NUBEQA. Talk with your healthcare provider about birth control methods. Are breastfeeding or plan to breastfeed. It is not known if NUBEQA passes into breast milk. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. NUBEQA may affect the way other medicines work, and other medicines may affect how NUBEQA works. You should not start or stop any medicine before you talk with the healthcare provider that prescribed NUBEQA. Know the medicines you take. Keep a list of them with you to show to your healthcare provider and pharmacist when you get a new medicine. NUBEQA may cause serious side effects, including heart disease. Blockage of the arteries in the heart, ischemic heart disease that can lead to death, has happened in some people during treatment with NUBEQA. Your healthcare provider will monitor you for signs and symptoms of heart problems during your treatment with NUBEQA. Call your healthcare provider or get medical help right away if you get chest pain or discomfort at rest or with activity or shortness of breath during your treatment with NUBEQA. Seizure. Treatment with NUBEQA may increase your risk of having a seizure. You should avoid activities where a sudden loss of consciousness could cause serious harm to yourself or others. Tell your healthcare provider right away if you have loss of consciousness or seizure during treatment with NUBEQA. The most common side effects of NUBEQA include increase in liver function tests, decreased white blood cells, neutropenia, feeling more tired than usual. The most common side effects of NUBEQA in combination with docetaxel include constipation, rash, decreased appetite, bleeding, weight gain, high blood pressure, decreased red blood cells, anemia, high blood sugar levels, decreased white blood cells, increase in liver function tests, low blood calcium levels. NUBEQA may cause fertility problems in males, which may affect the ability to father children. Talk to your healthcare provider if you have concerns about fertility. These are not all the possible side effects of NUBEQA. Call your healthcare provider for medical advice about side effects. You are encouraged to report side effects or quality complaints of products to the FDA by visiting www.fda.gov/medwatch or calling 1-800-FDA-1088. Please see full prescribing information at www.nubeqa.com/PI. Ask your doctor about the NUBEQA free trial program.